My reaction this morning is just one of sorrow and discouragement. I think a very, very serious mistake was made yesterday. It will lead certainly to higher taxes, higher health care costs, and a much weaker economy going forward. And, but the Congress was determined, and now we'll live with the consequences. The first consequence is, for Indiana, is that we'll suspend enrollment in our HIP program, which will be annihilated by this new bill. I've asked Secretary Murphy to think about an orderly termination of this program, and that's very sad because it's bringing peace of mind of health insurance to 50,000 low-income Hoosiers now. So we'll look at the best way to wind it down over the course of time.
What specifically in this bill forces you to get rid of HIP?
Oh, it will subsidize people. It will force people into Medicaid, and then above that offer a subsidy. There's no room in this bill for personal responsibility. There's no room for innovative programs like HIP. And I think it's a sad thing, but the federal government has now taken over an additional 18% of American life and the American economy. We'll just simply have to surrender to that reality.
But Governor, some might argue that American life and American economy is not insuring, is not providing on its own health insurance for millions of adults and millions of children. What's wrong with getting health care coverage to people who don't have it now?
What's wrong is placing enormous new taxes on the job generators of small business and investment, huge new taxes on the next governor of this state is going to be faced with a massive new Medicaid cost that we don't face now, and that is an additional tax which will be paid through your state sales and income taxes. There were so many better ways to do this that could have empowered Americans, as the Healthy Indiana Plan does, to look after their own health care, could have given them the tax benefit now given to employers, as opposed to a nationalized system that we will now be forced to move into.
Governor, under the bill, when does the expansion of Medicaid actually go into effect?
In about 3 years, as I recall.
And why suspend new enrollments into HIP now if people could get services for the next 3 years until that expansion?
Well, I've asked the Secretary to figure out the right way to terminate a program that the federal government has decided to terminate for us. But as at least a precautionary move for the moment, I don't see any reason to add people to the rolls of a program whose days are numbered.
There was a tax that was increased to start the HIP program. Any thoughts on how that money should be used? Could that cushion the Medicaid blow in the future? Obviously, probably up to a future governor to make, but I wonder if you had any thoughts on that.
Not yet.
One of the reasons we're losing primary care physicians is because the Medicaid and the Medicare reimbursement rates are so low. What's wrong with increasing them and maybe encouraging people to go into that field where they're badly needed?
Actually, I don't see that being the effect of this bill at all. I think this bill will drive physicians away from the Medicaid program. What you're already seeing in Medicaid is people who technically are covered but can't find a doctor. And we will, under this bill, we will have 1 in 4 Hoosiers on Medicaid. It's not the best health care, and it will be probably worse then than it is now.
Well, how will increasing the reimbursement rate drive physicians away from that program?
First of all, this is one of the fraudulent assumptions, and I would use a weaker word if one were called for, but it is absolute fraud not to admit that this will add trillions to the future debt that we're leaving to our children. And one reason is they're pretending they're going to restore or raise physician reimbursement. They're going to raise those rates, and they're going to, in the process, unwind the supposed fiscal premise of this bill.
The Attorney Generals in 3 states are planning to file legal challenges against it. Have you had any discussions with RAG about that?
Our staff has talked to him, and quite correctly said the Attorney General said he wouldn't think about it till he saw a bill. So it's a question best directed to him, but I know he started to look at it now.
Can you talk about the concern you have particularly for small businesses? I noticed you put in your statement, because the argument has been made that this could lead folks to start their own businesses because they wouldn't be worried about losing their insurance if they leave a job, that they have this peace of mind to be able to get affordable insurance and start up a business, things of that nature.
Small business will be forced to pay a penalty unless it buys insurance with a lot of new mandates in it, very expensive insurance. By the way, immediately the cost of insurance is going up. There are new mandates in this bill that may sound good and feel good, but it will cost money to do that. And so the insurance that small business is now ordered to buy will be more expensive. Many of them will, I think, decide that the least damage they can do themselves is simply to pay the penalty.
I'm sorry, Governor. I'm still a little unclear on why, with 3 years, why suspend new people getting into HIP when even if they could only stay on it for a year, I would think it would be helpful for those people who need low-cost health care now.
Until we understand the full implications of this bill, I don't want to take on any more obligations than we have to. This is just a temporary suspension while we try to measure the extent of the damage that this bill is going to do us.
So it's possible that you might resume.
Yes, it is. There are some populations, families with children, I believe, whom under the, as long as the stimulus, so-called stimulus bills in effect, we are mandated to continue enrolling them. So I should qualify it that way. Those people will continue to be enrolled. The HIP program experiences some attrition each month as people either find work with insurance or leave the rolls for some other reason. So odds are that HIP today is as large as we're going to see it, which is too bad.
A lot has been made of those CBO numbers, the saving the $1.3 trillion over the next 2 decades. I mean, do you see this as a calculated effort to deceive people? Is that?
Yes. That's why I use the word fraudulent. I mean, everybody gets the joke. 10 years of taxes counted against only 6 years of spending, pretending that they're not going to restore the so-called doctor fix. Double counting left and right. It's the worst sort of Washington deception, and they've been a lot better off to simply say, yes, it's going to cost trillions of dollars more debt, but it's worth it. And I think they do believe it's worth it, and they should simply have made that case honestly, as opposed to pretend that this is not going to be enormously expensive. You cannot subsidize 30 million people with tax dollars and not have it cost a lot of money.
Do you have a sense of what the additional Medicaid cost for Indiana will be once the expansion goes into effect?
Hundreds of millions of dollars. We spend about $1.8 billion, or a little bit more than that now. If it were today's costs, you could raise that, Leslie, by it's about a third. So when we looked at the first time, it was 600 or 700 million, something like that. Now, probably more in a couple years when a couple 3 years when the hit gets here. The Medicaid cost is buffered for a few years, the way they wrote this bill, but it's coming, and it'll be extremely expensive as it gets here.
Did you watch the developments last night, or did you just kind of?
I was watching Sports Center. Found it a lot more pleasant.